Well, who's going to advance the slides? Victoria, are you going to do that?
Yeah.
Do you want to share your screen then so we can just kind of, that way you can practice it while we're going through
Yeah,
it?
it's a good idea. All right. Let's see.
I don't know that I would go in present mode or whatever. You might, but I need to read my notes right now.
I'll need to leave the notes too, so I'll just leave the notes up for everyone.
Okay.
Let me just figure out how to share my screen. There we go.
One brief comment. So is that your next paper, Jenkins, The Final Frontier, Edge of the Sofa?
Y'all, I told you, I don't know if I told you this, I ended my 6-minute reflection with like, you're asking me where I see myself in 5 years in clinical practice. And all I can think about right now is that I'm never going to be in school ever again. I'm going to just leave it right there. And that's how it ends. Like, I'm never going to be in school ever again.
Ever again.
Have y'all done the other little thingies that we have to do for this? We have to have a reflection thing.
No.
Have y'all done any of that?
You can't do the reflection on this until somebody else posts, because it has to be on another person's presentation and not somebody that presents the same time that we do.
Oh, okay.
Mm-hmm. And like, no shade, I don't know if I want these points. Sorry.
All right. Before we get too carried away,
The biggest facts. Yes.
Yeah.
Okay. So let's start. I'm going to put the timer on here on my phone.
I can't see the notes very well, so what I'm going to do is pull mine up and just go from mine.
Okay.
And so just tell me when you get ready to start.
Okay.
And did y'all look at the title? Are you okay with that?
Yep.
Yes. I think you did a good job.
Okay.
All right. Is everyone ready?
Uh-huh.
Yes.
Okay. Start.
Hello, everyone. Today's group members are Victoria Cashin, Jenkins Lawhorn, Julie Percival, Maury Wiles, and Nicole Wilson. Today, we would like to discuss the health disparity of breast cancer diagnosis and treatment in African American women. We are aware that the majority of us leading this discussion are not a member of the group we are about to discuss. However, we are allies because we realize that this health disparity needs to be addressed. We are speaking from a place of injustice, seeking improvement, and not a place of judgment. Please join us in this discussion and work with us to resolve this social injustice. So for an analysis, in the United States, breast cancer is the 5th leading cause of death among women. 1 out of every 8 will be diagnosed with breast cancer in their lifetime. Despite slightly higher screening rates than Caucasian women, breast cancer mortality is 40% higher in African American women in the United States. Evidence has shown that mortality and healthcare costs can be reduced with early detection and treatment of breast cancer. The importance of social justice is based on research, education, and evidence-based practice. Kagan, Smith, and Shin stated it best in Chapter 22 of Philosophies and Practices of Emancipatory Nursing when they said, "Emancipatory nursing embraces and nurtures social justice goals and outcomes where practice becomes praxis, aimed at forms of knowing and doing the better to better mankind. Marginalization and discrimination due to race, gender, or socioeconomic status perpetuates disempowerment and inequities in health, education, and income in all nations, both rich and poor."
Structural inequities are identified using a Day's model of vulnerability. Social status identifies race and gender, such as African American women, as areas of vulnerability, and human capital includes education, employment, income, and housing. Research has shown that African Americans are more likely to have a lower level of education, be uninsured due to lack of employment, and live in poverty in substandard housing compared to Caucasians, resulting in a higher risk population. Inequities in care increase the risk of late screening and diagnosis and higher mortality rates. Research has shown that 20% of African American women had more than a 60-day delay after an abnormal mammogram until breast cancer was diagnosed, with 26% receiving a stage 3 or 4 tumor diagnosis, which is the highest rate in any population. These delays result in higher mortality rates due to breast cancer as well as higher recurrence rates. Differences in survival with similar stages at diagnosis are also noted, suggesting that cancer is fundamentally different between races. Disparities also exist in access to care with screening, diagnostic services, and treatment. This slide depicts how African American women have a lower incidence rate compared to Caucasian women but experience higher mortality from breast cancer.
Rawls argues that the concepts of freedom and equality are not mutually exclusive. And for a system to be just for everyone, he notes that people must be afforded the same rights under the law despite their privilege, social status, race, or gender. Healthcare is an opportunity or the greatest opportunity in life that should be available to all individuals like relationships and jobs. Health or the lack of health affects all elements of the human experience. Poor health may lead to poor healthcare may lead to poorer health and a poorer life overall. A few simple questions to ask yourself. Could you schedule an appointment for a routine mammogram without an order? Are there breast specialists near your hometown? Could you get a 3D mammogram if needed?
Sorry.
Oh, has anyone come to your neighborhood, your school, or your place of worship to talk about the importance of routine screening? For a majority of women, especially Black women, the answers are no. Changing the policies and funding issues that create these no's are a starting point. We would like to ask for increased funding to initiatives like REACH, the Racial and Ethnic Approaches to Community Health Program, through the National Institute on Minority Health and Health Disparities, to help carry out local, culturally appropriate programming to address a wide range of issues affecting diverse populations.
The winners of the current healthcare disparity are Caucasian women, high-income families, as they have access to care. The insured, they are screened earlier and treated quicker. Private physicians, because the insurance pays them for screening/well woman exams. The oncologists, because their patients have more advanced disease and require more treatment, therefore more money is paid to them. Also, insurance companies, because they don't cover patients at most risk for advanced disease and therefore save money. Pharmaceutical companies, because they provide chemo and medications for cancer treatment, and plastic surgeons and oncologists, because they have job security. The losers, of course, are African American women and their families, low-income families, and uninsured, as they don't have ready access to care, health departments and free clinics because they have been cut funding, and employers because their employees have to miss work for treatment appointments and surgeries. The winners of the solutions are African American women and their families, low income and uninsured, as they will have access to free clinics and health departments that will provide them free /sliding scale screening. Radiologists will also be winners as they will have job security. Researchers will win because we will advocate for funding for them to research breast cancer in African American population. Employers will benefit as their employees will be healthier and take less sick time, live longer, therefore have more working years. And health departments and free/low-income clinics will benefit as well, as they will have government funding. The losers will be pharmaceutical companies, plastic surgeons, and oncologists, as they will have less clients.
As we apply the Milstead process, we see that the agenda was set when Representative Henry Waxman of California proposed increased breast and cervical cancer screening for underprivileged and minority women in 1989. Medicare then began providing reimbursement for mammography in 1991. The Community Preventative Services Task Force Systematic Review finding from 2009 supports reduction of an individual's mammogram cost to effectively increase screening rates. An executive government response established funding for mammography screening for underserved women. Congress passed the Breast and Cervical Mortality Prevention Act in 1990, which permitted the Centers for Disease Control and Prevention to establish screening services for breast and cervical cancer for low-income and underserved women. The proposal was considered and passed by both the House and the Senate before being signed into law by the President. The CDC then spread funding for screening mammography services with the introduction of the National Breast and Cervical Cancer Early Detection Program. The program included all 50 states, additional U.S. territories, and the District of Columbia. The Breast and Cervical Mortality Prevention Act was implemented through established funding consisting of $50 million for the first 3 years. Additionally, the passage of the Affordable Care Act ensures preventative services are covered for the individuals with insurance. Our proposed policy change would include increased funding for cancer research trials specifically aimed at minorities, particularly Black women. We feel the inclusion of the National Institute on Minority Health and Health Disparities REACH program in the policy development is paramount to the success of combating current racial disparities. Funding for this program should be a priority for state and federal governments, as this is a major health issue. The program should undergo evaluation based on research data collected through the proposed clinical trials every 5 years until this disparity is resolved.
All right. I have 8 minutes and 30 seconds.
What do you guys think about the conclusion? Are you okay with that?
I thought it was fabulous.
Yes.
At the end, do you want to say these are the references?
Sure. I also wanted, it said something about implementation, which I didn't talk about, but like, do you want me to say something about, and then for the budget for the next financial year, this, funds should be allocated and then this should be implemented in the next coming year or something, fiscal year? Do you think that would be sufficient?
You do whatever you want to.
Mm-hmm. Regime, next president, next governor.
We're going to take over the world! And then we're going to force them to do mammography screening on everyone!
You get a mammogram. You get a mammogram. Everybody gets a mammogram. Sorry.
And twice a year for Black women.
Yes. Oh, blessed
Hey,
assurance.
Victoria, on your winners and losers, the 1st slide, you have oncologist on the winners side twice. Did you?
No, thank you for saying that. Do you think I need any other winners and losers on anything, or did anything not make sense to you with the way that I said it?
Should I? In my slide, I talk about Black women, but we talk about African American women. Do you want me to change it to African American women so it's
That's what I was getting ready to ask. Are we
consistent?
consistent throughout?
It's such a nuance because, like, I'm African American, and like my friends, people always assume like he's African American, but he's Jamaican American. Do you know what I mean? So like we could say like African American and or Black. We could say Black because that's like all encompassing. I feel like people say African American because they're trying to be PC, but really it's not PC because like my friend from South Africa who now got her visa is African American. You know what I mean? And she white.
Black then?
So
would you matter that we say Black women?
Yeah. I think we should say Black women because like what Jenkins is saying, like just because you're Black does not mean you have or ever have come from Africa.
I agree.
Or you associate yourself with that. Like there are other places you could be from.
And the term Black women is not going to be derogatory to anyone.
I don't feel like it's a derogatory term, but I don't know that I have a whole lot of place to say that. But I feel like that's where the disparity is Black women. It's not just African American women. It's all Black women.
That's true. That's a good point.
Jenkins, what do you think?
I get what you're saying, Nicole. I see where you're coming from because for so long, so many people have been like taught to say like African American. I feel like we can like introduce and I don't know.
Or do we say African American Black women?
African American or Black women. Or at some point in our introduction, do we make a disclaimer like right when you say your ally statement, like in our presentation, we will be referring to this population as Black women because we know that there are various Black backgrounds. Not everyone is African American. And so then that can just cover it in our blanket statement. Like we're talking about brown, Black women.
Well, that's why I ask.
Yeah.
The receptionist at my office is African American, and somebody referred to her as black one day, and she said, "No, my skin is brown; it's not black." So that's why I wanted to make sure. I didn't want to offend anyone. So
no. So totally, we can be like, in this conversation, we will refer to like brown or black women.
Okay.
Meaning this category. Yeah.
Jenkins, this may be inappropriate to ask, but I feel like we have a rapport, so I want to ask you this. My personal experience is that the only people that refer to black people as African American are white people. Is that true or is that not true?
Yeah.
Like, I feel like we do it because we are trying to be politically correct, but that's not really the identity that a lot of black people have.
Right.
Is that?
Yeah, I mean, like, for me, like, I only check that box when, like, it's given as an option. It's not like where I'm like, oh, I'm going to hang out with my African American friends. I'm like, nah, me and my black friends are going to. But also, like, but I very much talk about, like, black, brown, yellow, tan. Like, that's just a bunch of, like, my conversation is, like, how, like, I refer to people. Do you know what I mean? Because for me, like, brown for me is, like, Hispanic Latino. Do you know what I mean? So
I would say brown for me would be Hispanic, Latino, Indian.
Yeah.
Like Arab type countries.
So, but yeah, it's just, but I also just think it's part of it. You're right. It's just how you were raised and what people have taught you to use.
I have a question about Jenkins, about the policy solution.
Yeah.
I don't know. Did you mention anything about the funding that we're trying to restore to the state?
I had it in there, but I took it out. Something about restoring the funding and having availability. Well, I mean, Jenkins kind of asks it in a question statement. The rest of the stuff that I took out, where
so I need to take that out of my winners and losers then, if that's not.
Or I don't know. I was just like changing the policies and funding issues that create these no's are a starting point. You want me to be like return money that's been cut, or like?
I just didn't want to talk about it if it was never mentioned before, so I could just take that part out.
I told him to give us the money back. Change the policies and funding issues that are created that create these no's.
Okay, sorry, I was trying to listen to what you said, but I didn't read all of your things. So you said changing, say that again?
I would just said policy and funding issues.
Okay, yeah. I feel like there's so much in this that we can't mention everything. It's like such a general, I feel like if someone's just listening to this presentation, I think they would be confused because there's like this Milstead process and there's just like these.
Really? Because I was like, oh my gosh, we sound so smart.
I know.
That's where I was. I was like, oh my gosh, we sound so smart. Look at this. Look at us taking on health disparities. Look at us being just so justice conscious. That's where I was in my
I'm not just
breakdown of it.
I'm just saying the way that the way that it's made, that it's so wordy with the processes and stuff. I just get confused listening to it. But I'm not saying we did anything wrong. It's just the way that this PowerPoint is made to be. So I think everyone did a good job.
I think we're good. I feel a 25 coming on.
Okay.
And I only need 10. So
How many do I need?
But it's doing the math.
No, I've done that before. I've not finished my
What'd you say, Julie?
Did 25 worth of work though.
Yeah. Oh my goodness.
Okay. All right. So we present at 8 on Thursday, correct?
Friday.
Is it Friday?
Friday.
The 14th.
The 14th day of June?
Yes, that's Friday. Sorry.
Okay.
Yeah. Because
I was just
like,
thinking our stuff is due on Thursday.
I was
So-
like, because that induction I just scheduled for Thursday will be an issue. So, okay.
So what do we turn in on Thursday? Just our PowerPoint?
Our slides are due.
Is it Thursday that it has to be turned in?
It has to be turned in the day before. I
Okay,
think-
well, let me work on it some tomorrow, and I'll tell you I'm done. Because I want to change. I want to add a picture instead of the stupid Milstead process. It'll be a lot prettier.
Mari, do you just want to submit it on Thursday?
No, I just want to tell somebody to submit it tomorrow afternoon.
I'll submit it whenever we get done. If everybody will just let me know when theirs is done. And then we probably need, I'm just going to make a copy of it and we'll take all the notes off and submit that. That way I leave the notes on the one that we're doing.
Okay, sounds good. Yeah, I mean, I'll just email you guys when I'm done.
Wait, before you delete all the notes, let me print it.
Well, I'm not going to delete them. What I'm going to do is make a copy of it and I will delete them off of that copy and submit that copy.
Okay.
That way it leaves our notes on there so we can print them whenever we get ready to.
Sounds good.
And then who's going to submit the discussion part that we have to do?
Are we going to submit that email that we've been doing?
The email has to be in a certain format, and no offense, but I'm not taking that on.
So do we just want to do the 2 videos?
Yeah.
I can do those when I submit the other part. So.
I think there's going to be 3 videos.
Okay, yeah, the 3. I can submit those whenever I submit the other part.
Perfect.
And that way it's just one person doing it and I know it's all done. So
Sounds great. I'm excited. I've enjoyed working with you guys.
me too. We've had a great group.
Yay. Now that we've come to the end of the road.
You three that are done this time, you're going to be getting some crazy messages from me in not too many months. So just be prepared. Jenkins, don't block my number.
Girl, bye. I don't block numbers. I've had the same number since the first time I went to college in 2002. Anybody can find me. like literally.
I think I've had my
also
number since like 2000.
Yeah.
You want to
Anybody? So yeah.
I
So
would be
I think-
sad if they took away my phone number.
So do y'all know much about the presentation on Thursday? Because it's 2 groups. Are we presenting at the same time, like one of us presents and then the other presents? Or do you know, I probably should have read this somewhere and I may have, but you know, there's only room for so much in my immediate brain space at the time. So
I feel like that's correct.
It's like a BBB that we just log into or something.
Mm-hmm.
Cool. Awesome. Good work, team. Go team.
Go team. You guys are great. Thank
All
you for
right.
putting up with me.
I'm gonna go watch something on the DVR because I've just been watching TV. It's so exciting to just watch TV. I'm sorry, I know I sound like crazy, but I haven't done this in like forever. Like just come home and like watch TV. Like all my notes are closed at the office. I don't have to work tomorrow, and I'm just gonna stay up all night and watch TV.
I'm going to show y'all this. We moved in April, and this has been where I haven't been able to enjoy. This is my back deck,
Oh,
That's so lovely.
and there's a pond over on the other side there. So I have to fight the mosquitoes sometimes, but
You look
It's
like that
some
was like
bat.
my old
Hey,
house in Tennessee.
You should get some like bat houses.
we have some purple martin boxes. But when we moved, the lady that was here before took the ones with her. And so by the time we got moved and got some put up, it was too late for them. So, but I've got citronella plants everywhere and that's helped. So
It's beautiful, Nicole.
thank you. And it's quiet. I can hear no traffic and nobody can see my house and I cannot see anyone else's.
Wow.
But I am 3.8 miles from the clinic to my house.
oh, girl, isn't it?
I'm at the dead end road of a 1-lane road. I have nobody around me. The river is right there, and I'm 5 minutes, or if I get stopped at the red light, it takes me 5 minutes to get to work. So
Okay. Well, I'm 11 minutes from work in Elon. I live down like the state doesn't maintain the road kind of road, but so I'm back here, but
And
That's
Mari
why my
lives
internet
in a
is
multi-story building with the downtown in front of her.
I know.
Wait, sorry, I was distracted. What?
And they were saying they live in the boonies, and you live like right smack dab in the middle of the city.
Yeah, there's legitimately a bar like right below where like two. There's one over there and one over there.
Well, I would have to walk around the house to show you our bar, but it's on my property. That way nobody has to drink and drive.
Exactly. Just
Awesome.
stay here.
Well,
Stay here.
that's why I live in the middle of the city, so I
There
don't
you
have to drink and drive. You just drink and
Right.
stumble.
We had to get enough bedrooms so that if anybody came out to the woods to enjoy our company, they don't have to go anywhere but upstairs to one of the beds.
Such a nice view, Mari. Where are you again? What is that?
Atlanta.